Delhi, Mumbai, Kolkata, Lucknow. Hair educational video. In this video, we are going to see how hair grows. Both male and female hair has been shown to grow and respond to treatment in exactly the same way. Therefore, the information you are about to see applies equally to women as well as men. Let's zoom in and take a closer look. You can see that the hair, skin and blood vessels form a quite complex structure. This is called the hair follicle. The hair cycle. Hair has a natural cycle. Almost as soon as the hair dies, another one starts growing from the oval of stem cells called the dermal propeller. As it grows, it pushes the old hair up and continues growing until it dies too. This natural cycle has three different phases represented on this clock. The growing phase of the hair is called the anagen phase. Early anagen starts with the first emergence of the new hair, which pushes out the old one. Anagen continues and the hair keeps growing for up to 6 years. In like, anagen growth slows down and then the hair enters catagen, that is the dying phase. In catagen, the growth stops and the hair follicle are broken down as it detaches from the dermal pillar stem cells. This phase lasts up till 6 weeks. The hair then enters telogen, a resting phase, which lasts around 6 months. As the hair is no longer attached, it cannot be repaired. It loses condition and can appear dull. Hair growth factor. Signals from the scalp as well as in the body control every step of the hair cycle. Some signals, like these black ones, tell the hair to die or fall out. Others, like these blue ones, tell the dermal propeller cells to start growing and producing hair. These blue signals are called growth factors. You can see the blue signals last drive the way through the anagen phase, keeping the hair growing. When the black signals will turn, they tell the hair to enter catagen and it dies. Shortening of the hair growth cycle. There are some people in whom this process continues exactly the same for their entire lives. Anagen phase lasts for 6 years or so before catagen or telogen makes the hair fall out over a few months before the next cycle starts. But for many of us, it changes as we go through certain life stages, resulting in thinning hair. In this case, hair goes through each stage of the cycle as no more. But the anagen phase is shorter. Each time this means that your hair starts to grow more slowly and will grow as long. Each cycle gets weaker, shorter and less colored. This process is called miniaturization. Below the follicle is not dead, it comparably produces any hair at all. At Enhanced Clinic, age no bar. You can be 22 or 82. With vast experience and superior technique, we at Enhanced Clinics have successfully done hair transplants for over 4,000 plus patients of all ages from 22 to 82. Pattern of baldness in male and female. Male pattern balding, better known as androgenetic alopecia, is the most common type of hair loss. The hairline gradually moves back or recedes and resembles an M shape. The cause of androgenetic alopecia is hereditary, and there is usually a genetic history of it, up to 3 generations on either the mother's or the father's side. Balding in androgenetic alopecia is caused by the action of DHT, that is dihydrotestosterone, which is the active form of the hormone testosterone on the receptors present in the hair follicles. We classify balding in Hamilton-Norwood range of 1 to 7 for men and Ludwig range of 1 to 3 for women. Hair also thins at the vertex area. that is, near the top of the head, forming a U-shaped pattern of hair around the sides of the head. This can lead to full baldness, also known as alopecia totalis. There is a cure for male pattern balding or female pattern balding. Hair transplant, a medically proven safe and permanent procedure nowadays. Dr. Manoj Khanna is a well-known cosmetic, plastic and aesthetic surgeon. He is a board-certified plastic and cosmetic surgeon with the highest qualifications in plastic and cosmetic surgery in the country. Over 2 decades of experience. Over 2 crores hair follicles transplanted till date. His qualifications are MBBS, MS, MCH Plastic Surgery, DNB Plastic Surgery, FICS USA and Fellowship Cosmetic Surgery USA. He is highly experienced and trained with famous aesthetic surgeons at different well-known cosmetic surgery centers in California, Chicago, New York, Miami, Detroit, London, Paris, etc. He is a member of the International Society of Aesthetic Plastic Surgeons, that is ISAPS, life member and executive member of Indian Association of Aesthetic Plastic Surgery, IAAPS. He was awarded the Swami Vivekananda National Award for Healthcare for the year 2011 in New Delhi for his contribution to the practice and teaching of aesthetic surgery in India. He was the president of the Association of Hair Restoration Surgery of India in 2012. He was president-elect of the Indian Association of Aesthetic Plastic Surgeons. Well-known film stars, cricketers and celebrities have experienced the benefit of hair transplant and cosmetic surgery at various centers of Enhanceclinics, guided by Dr. Manoj Khanna.
Hair loss is genetic in 97% cases. A gene in the family up to 3 generations above you, if inherited, causes loss of hair. Hair loss is in the front and the center of the head. But nobody loses hair in the back of the head. The hair at the back of the head are permanent, and if hair roots taken from there are transplanted anywhere, on the head, on the forehead, on the nose, on the cheeks, on the eyebrow, on the mustache, once transplanted, they stay for life. And they grow like normal hair, need haircuts, never fall. You can comb them, oil them, shampoo them, and they stay for the rest of your life. There is no age limitation for hair transplantation. Hair transplant can be done in anybody from the age of 18 to 80 plus. In fact, if you're medically fit and there are no problems, you are a good candidate for hair transplant. Any hair in our scalp grows for 2 to 4 years, falls off one day, but the roots remain. They take rest for 2 months and they start growing again. Transplanted hair also, because they are moved from the back to the front, the outer part falls off in the next 2-3 weeks, but the roots remain. They take rest for 2 months and they start growing 3 months from date of surgery. Hair grow at the rate of 1 centimeter a month. The hair we keep are normally 3 centimeter, 4 centimeter long, so in another 3-4 months to reach that size, which means the result of a hair transplant can only be appreciated 6 to 8 months from the date of surgery. The entire operation of hair transplant is under local anesthesia. It takes 3 to 6 hours. A team of 3 to 6 people work together. Throughout the operation, you're awake. You're listening to music, watching television, there's a break, you have your lunch, and you go home immediately after the hospital. There's no staying in the hospital. In fact, Harsha Bhogle finished surgery at 5:30, went to the airport, took a flight, went back to Bombay same night by the 8:30 flight. Since the surgery is on the scalp, outside the skull bone, the brain is inside the skull bone, it has no side effects. Transplanted hair cannot be differentiated from your original hair by anybody, not even your barber. They grow in the same way, they grow in the same direction, they grow at the same rate. You can comb them the way you want, style them the way you want, apply shampoo on them, oil them, gel them, dye them, streak them, spike them, have a haircut, even shave them. They'll come back because they are your own original hair. I have done more than 4,000 hair transplants till now. We do about 1 or 2 every day, and I'm doing it for the last 19 years. Well-known people you see every day like Harsha Bhogle, Shastri, Madan Lal, Nikhil Chopra, Charu Sharma, Joginder Sharma, Roger Binni, Brijesh Patel, Lal Chand Rajput, Dr. Wes Pays, father of Leander Pays, Dilip Vengsarkar, Pathan, VVS Lakshman, they all have done a hair transplant here with us.
People from 65 countries come to us for hair transplant and cosmetic surgery.
Who have had a hair transplant with us and been happy. I'm very happy to state that for more than 10 years now, there's not been a single patient who's not been happy with a hair transplant at our clinic. There are two different ways of doing a hair transplant, either the strip technique or FUE. The strip technique is the best and commonest technique done all over the world. In fact, 80% of cases are done by strip technique in the world. What we do in a strip technique, we take a strip of permanent scalp from the back of the head, including hair with hair roots and skin. A strip about 1 to 1.5 centimeter in width is taken, and that gap is closed immediately. A special plastic surgery technique of closing the strip scar known as trichophytic closure is done so that hair grows through the scar and you can never see the scar. It's hardly visible and noticed only when you shave your head. This strip has a lot of hair. We take out the hair individually along with its roots to make numerous follicles. Depending on the number of follicles we've made, we'll make small gaps in the areas you don't have hair. Into these gaps, these follicles are placed, and once put in, they stay there and they grow like normal hair. The other technique is called follicular unit extraction or FUE. FUE is a useful technique but only in small cases. In a strip, we close by a special technique called trichophytic closure, where there's a fine line. Hair grows through the scar. You can never see the scar. Unlike in FUE, and the commonest and the gold standard in hair transplant is the strip technique. How many hair I can transplant in one sitting depends on the density and quality of your hair at the back, which I cannot change. To give you an example, I did a hair transplant for Harsha Bhogle and Shastri. Harsha had very good thick hair at the back. One shot, entire front of the head was covered. It looked so different. On the other hand, Shastri had very thin, poor hair. His father was like L.K. Advani. I did 2 sittings for Shastri, but I could only cover the front. The back is still empty. So, good hair at the back, I can cover a huge area in one sitting. Whilst if the hair is not that good, you can repeat a sitting 3, 4 or 5 times to cover a large area. Anyone can do 5 or 6 hair transplants. In fact, a common ad you might have seen on television of Naukri.com. A very angry boss, Harish Sadhu, H for Hitler, A for arrogant, R for rascal, I for idiot. But that guy is actually Bobby Parvez, a well-known model of Mumbai. His father was fully bald. I did 6 rounds of hair transplant for him, once a year. And believe me not, I saw him last year doing an ad for Palmolive gel.